Now, we've been talking a lot about essential drugs. So, some people might just feel like this concept of essential drugs started in recent times all of a sudden, but it actually has a deep root back in history time, right? How many societies try to actually implement the concept of essential health and how it has actually improved over the years. So for essential health, what we got is this. First of all, you should know that it was what introduced by World Health Organization in 1977. So it was a landmark in global health policy, and it was aimed at ensuring that all people, regardless of where you stay, regardless of how much you earn, at least you can be able to access some drugs that will be able to treat some basic disease conditions as related to your location. So, what's the origin? Let's go back in history. So, we said that in 1970s, many countries were facing shortage of vital medicines. When you say vital medicines, not all sorts of drugs. You know, for the common disease conditions like infections, all those inflammatory conditions, headache, all those kind of things. At least those ones are the ones that worry us the most, right? So we should always have solutions for them. So, World Health Organization recognized the need for a prioritized list of medicines that were safe, effective, and affordable. So, the first list of essential medicines had about 200 drugs, and it was published in 1977. Okay. So, what's the evolution rather? So that the list has been updated. Okay, different disease conditions are emerging. Some disease conditions are getting low. Some are even eradicated. You understand that kind of thing? So the list is actually dynamic stuff. It has to be changed just to fit in and improve what treatment and also tackle all the emerging diseases. So over time, the scope expanded from basic primary care drugs to include some drugs for chronic diseases, cancers, and also advanced therapies. So countries were encouraged to adapt the World Health Organization list. So when you adapt the list, you now modify it into your national list. Do you understand? So what are the objectives of essential drug concepts? It's just to ensure that key medicines are available and accessible, promote that people are using drugs safely. Because when you go to collect these drugs, you get to interact with a healthcare professional who gets to know your issue and gets to give you just the drugs you need. All right. So also support affordable healthcare by focusing on cost-effective medicines, and it also strengthens the health systems by guiding procurement, storage, and distribution. So it's just like the movements of drugs in a particular country is so controlled. All right. So there's reduced chances of abuse of the drugs. Okay, so impact. It has become a cornerstone of primary healthcare after the Alma-Ata Declaration in 1978. It has improved access to medicines in low and middle income countries. All right, it has laid the foundation for initiatives like the Drug Revolving Fund and the Universal Health Coverage. Now, all these organizations or all these programs will be covering them on this public health channel. So that's it for a little background history of how essential drugs actually came to be.